Hi, my name is Dr. Megan Chung, and I'll be talking about the history taking station for chest pain. You'll begin by reading the station prompt. Please read this carefully, and you can take any notes in your booklet of what you feel are important. So, any differentials or important questions. You'll knock on the door, enter, tell the examiner your candidate number, and then they will tell you that you can begin. Remember to sanitize your hands. Can introduce yourself to the patient and confirm their identity. Then you'll want to explain what you will be doing and get their permission for this. Here's a list of differentials for chest pain. It's good to have a few from each system, and then while you're taking your history, you'll be able to narrow them down. So you'll begin with the history of present illness, and you can start with using an open-ended question and just ask them to please tell you more about the chest pain that they've been experiencing. And just let them speak freely and try not to interrupt them, and show empathy and concern for what they've been going through. Once they've told you everything they want to, you can then start to fill in the blanks by asking them more close-ended questions, and this will help you narrow down your differentials. So the following questions are the more close-ended questions, and if they've already told you some of these, you won't want to ask them again, because then that will feel like they weren't being listened to. But I'll go through all of them. So you'll want to know the onset of how it began. Was the chest pain sudden or gradual? And what setting it was in? What were they doing at the time? Were they just watching TV? Or were they exercising? Or were they in a stressful situation, such as an argument? And then the course of it. So was it continuous versus intermittent? And if it was continuous, has the pain changed at all since it started? And if it's intermittent, how many times have they experienced this chest pain, and how long does each episode last? You'll also want to know the duration. Sometimes this may be given in the prompt. So it could be minutes, hours, to days. And then also if they've ever experienced this pain before. And if they have, you'll want to ask them more about that. Then you'll want to ask more questions, such as the position of where exactly the pain is, and you can ask them to point with one finger to where they're experiencing the pain. What type of pain? Is it squeezing pain versus a tightness or a sharp and stabbing pain? And then if the pain radiates anywhere, such as to the jaw or the shoulder, and then ask them to rate the pain from 1 to 10 so you can assess the severity of the pain they're feeling. Also the timing. Does the pain change with time? If it's been lasting days, does it change at different times during the day? Are there any triggers for the chest pain that could start it? And if the pain is better or worse by doing different things, such as taking a deep breath in, or position changes like leaning forward versus lying down, and any medication they might have tried taking for the pain, and if they have any medication, what is it and how much of it have they taken? Also, any associated symptoms they've noticed along with the pain. This could be sweating, vision changes, shortness of breath or cough, nausea and vomiting, dizziness, swelling in the legs, or a sour taste in the mouth. You can also ask about any red flags. So these are just some constitutional symptoms like fever, night sweats, chills, any appetite and weight changes, and lumps and bumps in the body. Also, any risk factors for chest pain, such as hypertension or diabetes, previous stroke, cocaine use, any recent travel or immobility. And you can also ask if it's had a big impact on their life, so for such as at work or at home and doing their daily activities. You'll then move on to their past medical history, asking about any allergies, any medications they take, which includes over-the-counter medications and supplements. And if they take any medications, you can ask if they take them as prescribed. Some people may stop taking medications from their doctor due to side effects, or they may have not had the chance to refill their prescription yet. Also, their past history of diseases, their last menstrual period, if applicable, and then any hospitalizations or surgeries they've had. And then on to family history, you can ask about the general health of their family and if there's any diseases that run in the family. Then for social history, you can ask about what they do for work, how they support themselves financially, and if the pain could be work-related. If they live with anybody and how that relationship is. Also smoking history, alcohol history, any use of recreational drugs, and any recent travel. Then you'll just summarize the findings to the patient and ask if everything is correct and if they have anything they want to add. You can then give them a preliminary diagnosis and the management plan. Then you'll ask the patient if they understand everything and if they have any questions for you. After that, you can thank the patient. And that's the end of the history taking station.